All right, welcome everyone to our pathophysiology review. We are going over a couple things here that include our introduction to pathophysiology, as well as the 7 mechanisms of disease. So you will find that if you follow along, this will really help you with our upcoming Quiz 1, which is on modules 1 and 2. For those of you who aren't in my class, this is really a great review for some of the things that you'll be presented with once you start your nursing pathophysiology class. So one of the first things that I want to go over involves the characteristics of disease, or how we classify these diseases, because we know that pathophysiology is the study of disease acquisition. So we kind of break this down into 2 categories when we're classifying diseases. The 2 categories that we're going to utilize here is acute and chronic. And with acute, usually the onset is rapid. There's one identifiable cause for this disease, and we know that testing, when we use testing diagnostics, it usually gives a pretty good indication of what the disease is. So when we look at chronic, we're looking at an onset of disease that is slow. A lot of times the cause can be uncertain. There's a multitude of things that are contributing to this chronic disease. And we see that diagnostic testing sometimes is of limited value. So once again, that's for our classification of diseases, acute and chronic. Now that is different from symptoms. When you're looking at someone who presents to you with symptoms such as nausea, vomiting, headache, that is what we utilize to get our diagnosis. So when we're classifying diseases, we're not, too concerned about the symptoms. That's for when we are trying to diagnose the disease. As far as just classification of the different diseases, we're just looking at acute and chronic. So that's kind of all I wanted to say about that area. One of the things that we want to definitely talk about in the development of a disease is predisposing factors. And that is kind of also known as the risk factors, which make a person or a group more vulnerable to a disease. So we definitely want to understand what the definition of what predisposing factors is. Next, we want to go over the different kinds of treatments that we have for disease treatment. We kind of put those into a couple categories. We got things like medications, which can include, chemotherapy is a treatment, a medical treatment. Administering medications, radiation, things like that. Those are all medicinal treatments, medications. And we want to differentiate that from alternative or complementary therapies. Some of the alternative or complementary therapies that we utilize are things like aromatherapy, treatment modalities like Tai Chi, Qigong, yoga, Reiki, prayer, any kind of massage therapy. Those are all the different kinds of complementary or alternative treatments. So that's definitely different from prescription medication or something like we use to treat cancer, like radiation, chemotherapy, surgery. So we want to be able to differentiate between medical treatment and then complementary and alternative therapy. Getting into some of the genetic disorders, We definitely want to know the difference between single gene disorder, chromosomal abnormalities, X-linked genetic abnormalities, and then those multifactorial genetic disorders. And really, when we're talking about, for example, something like Down syndrome, we definitely will categorize that in the chromosomal abnormality, because we know that with Down syndrome, they have that extra chromosome on number 21. So we call that trisomy. Trisomy 21 is linked with Down syndrome, and they have an extra chromosome, specifically on chromosome number 21. Looking at our abnormalities in chromosomal structure, we want to know the difference between something like a genetic disorder that is autosomal recessive and something that's autosomal dominant. Autosomal recessive is usually the chromosomal abnormalities that where both parents are just carriers of the disease. They don't actually they're not expressing this disease, but they're carriers of it. So they have the abnormality on just one of their chromosomes. So when both parents are carriers of the disease, you want to know the different breakdown of percentages that it's possible to pass it on to your offspring. So with autosomal recessive, we have both parents who are carriers. There is a 25% chance that a child can have the condition. There's a 25% chance that they will be a non-carrier, so they won't have the abnormality and they won't carry this on their chromosome. And then there's a 50% chance that they will be a carrier of it. So we definitely want to also know when there is autosomal dominant. And autosomal dominant abnormalities in their chromosomes, there is both parents are usually affected. So that means that they are expressing that disease. There's a much higher chance with autosomal dominant that they can pass this chromosomal abnormality or disease, genetic disorder, onto their children. So autosomal recessive, there's kind of a lesser chance that their offspring will present with the disease. And then with autosomal dominant, especially when both parents are affected, there's a much higher percent chance that their offspring will be affected. So it's important that you know the difference between being a carrier of the chromosomal abnormality or actually having it and expressing it. When you have the disease and you express it, both chromosomes are affected. When you're a carrier, you just have it on one of your chromosomes. So know those breakdown percentages, specifically with autosomal recessive and then autosomal dominant, and then whether both parents are carriers or if just one parent is a carrier and one isn't, or if both parents are affected, or if you just have one parent who's affected and one who's not unaffected. So know those different breakdown percentages with the offspring. We definitely want to know about some of the modifiable factors that we can change. We know that there's modifiable factors that contribute to disease progression, and then there's also unmodifiable factors. Within those modifiable factors, we have things like smoking. Smoking is definitely one of the top contributors to the development of lung cancer. And of course, there are other things that can contribute to the development of lung cancer, like viruses, having TB, environmental factors like pollution, but definitely smoking is that top modifiable factor that we have control over to limit our chances of getting cancer or any kind of disease. With some of the things that we can't modify, we look at things like age, genetics, sex. Those are all the things that we can't modify. So we want to be able to teach our students, that with the things that we can modify, we have a certain control over, and it's up to us as nurses to educate our patients on the right ways to reduce your chances of getting a disease. Looking at some of the labs that are important to understand, definitely you want to start understanding all the different things that are involved in a CBC, which is a complete blood count. With CBC, you can order it in two different ways. There's just a normal CBC, which contains platelets, hemoglobin, hematocrit, your white blood cell count, red blood cell count. But then when we order something like a CBC with diff, it's all those things included, but then they break down all the different white blood cells. So that includes your neutrophils, your lymphocytes, your eosinophils, your basophils, things like that. So CBC, we got, red blood cells, just in general, the white blood cell count, platelets. Within the RBCs, they're looking at our hemoglobin and hematocrit. And then when you add in the diff, they're just breaking down, they're adding all those things we talked about, plus the different breakdowns of the white blood cells. So that's really important to understand in our introduction to pathophysiology. We definitely want to know the difference between benign and malignant. We know that with benign tumor cells, that is encapsulated. So it's in a fibrous tissue that really limits the ability of those abnormal cells to spread throughout the body. So typically, if you had to choose between having a benign or malignant tumor cell, you definitely want to go with benign, because the chances of that metastasizing or spreading throughout the body are quite limited when comparing it to malignant. Now with malignant cells, those cells are very rapidly dividing. They are not encapsulated, so that allows these abnormal cells to be able to spread a lot more readily throughout the body. And when they spread like that throughout the body, it can introduce these abnormal cells to different parts of the body. Also important to know that with benign tissues, like I said, it's not easily spreadable, so it's not carried by the blood or lymphocytes. As far as malignant cells are concerned, remember that we talked about the undifferentiation. With malignant cells, undifferentiation is a bad thing, because what that means is the cells do not mature. So with malignant cells, you have all these immature cells that do not differentiate. They don't mature. So then they can't perform the function that they're supposed to. When you think of like a white blood cell that is immature, it's not going to be able to fight infection like it should. So that is associated with malignant cells that undifferentiated, they're immature. They won't be able to do their job. Another very important concept in our pathophysiology intro centers around the different types of immunity. And the different types of immunity, we can kind of break that down into two categories initially. Initially, we want to understand that innate immunity has to do with the immune system that you're basically born with. And that innate immune system is usually the first to respond to the presence of some foreign antigen. And that's important to know because this innate immunity it can't really make memory cells. It can't make memory immunity cells that are able to, fight an infection once, and then if it's presented with that infection again later, or that antigen later, then it can immediately recognize it and fight it a lot quicker. That does not happen in our innate immunity. Where that does happen is in our acquired immunity. So with our acquired immunity, we have a further breakdown into what we know as active immunity and then passive immunity. Looking at active immunity, we can break that down into two categories as well. We have what's known as natural active immunity, and that is where you get a disease, you fight it off successfully, and then your immune system remembers. It remembers if it's ever encountered with this specific disease later in life, it can recoup those memory cells and then more readily fight that infection. So a good example of that is you actually get chickenpox, fight it off successfully, and then for the most part, you're immune to that specific virus, of course, until maybe later in life when your immune system starts to deteriorate a bit, and all of a sudden now you have shingles or something like that. Within active immunity, we have also artificial active immunity, and that is things like your vaccines and your immunizations. So we definitely want to know the distinction between natural active immunity, where you get the disease, fight it off, and then artificial active immunity, where we are giving vaccinations or immunizations. On the other side here of acquired immunity, we have what's known as passive immunity. And with natural, we have two breakdowns here. We got natural passive immunity and then artificial passive immunity. With natural passive immunity, that's things like when mothers breastfeed the baby, they get their antibodies passed on to the baby. Those antibodies don't stay with the baby forever. Eventually they do wear off, but they kind of provide that initial protection against any kind of foreign antigens. With artificial passive immunity, that's things we talked about, like administering gamma globulins, immunoglobulins, or also known as antibodies like IgG, IgM, IgE, IgD. So knowing those different types of immunity is very important for our introduction into pathophysiology. Another thing that we definitely want to know are the different types of immune system disorders. With our immune system disorders, we can kind of categorize it into three different categories. So when we're talking about something like immunodeficiency, that can be categorized as your immune system is deficient and it is not able to readily respond to foreign antigens like it should. So some examples of that, we can say AIDS, acquired immunodeficiency syndrome, HIV, definitely under this category of immunodeficiency. We talk about another category, hypersensitive immune system, that's definitely an immune disorder, and that's what we think of as allergies, right? We come in contact with some pollen, some ragweed, something that we're allergic to. So hypersensitivity, we equate that with allergies. And then our last category of immune disorders centers around autoimmune disorders. And we know that auto meaning the self, where our own immune system is attacking our own tissues. So some examples of that, we got rheumatoid arthritis, lupus, systemic lupus erythematous. Those are all definitely good examples of autoimmune disorders where our own immune system is attacking our tissue. Another important concept here, we definitely want to know age-related changes that happen to our patients. It's very important that we understand that as we age, our tissues and our organs start to not work as well as they once used to. And this can really put people at risk for certain diseases. The bones get thinner, weaker, the muscles start to kind of shrivel, your skin becomes less elastic, your lungs aren't able to expand as well anymore, so that can really contribute to the different respiratory diseases that can come along. Looking at our age-related cardiac changes, we definitely know that as we age, we start to have this increased buildup of fatty tissue and collagen in that heart muscle. And it's important to understand that, as we age, the heart can kind of start to enlarge. And that is definitely one muscle that we don't want enlarging with this buildup of fatty tissue, this buildup of collagen, because the more that heart enlarges, the more likely it is that it's not going to be able to function like it should. It's not going to be able to pump like it should. And so that's definitely important age-related changes that we need to understand. Very important to know the difference between malnutrition disorders and malabsorption disorders. With malnutrition, we see that usually there's an imbalance in the diet. So this can mean either we're not having enough nutrients in our diet, or we're having too much, in which the case that obesity comes about. And with obesity, we know that your chances, the more obese you are, the more chance you have of developing cardiac disease or developing diabetes, specifically type 2. With malabsorption, it's important to understand that there is an impairment of your intestines to be able to absorb certain nutrients. So malnutrition, knowing the difference versus malabsorption is very important. Along with some of the eating disorders, it's important to recognize the difference between anorexia, where they're just not eating, bulimia, where they're alternating binge eating with vomiting, and then in that group of malabsorption disorders, it's important to put celiac disease into that category. And celiac disease, that is where they are not able to absorb the nutrients like they should. And in celiac disease, that's also where we see things like gluten intolerance, that intolerance to things like wheat and rye. So if we do have patients who have celiac disease, it's important that we educate them about what kind of foods they should be avoiding. Lastly, it's important to understand the different types of wounds that you're going to see. We have things like our crushing injury, our laceration injury, avulsion injury, and then puncture injury. Remember, with avulsion injury, we had that picture of basically the skin was completely torn away from that finger. With crushing, obviously it's gonna crush the tissue. It may crush, it'll probably injure the muscle, and it more than likely will injure the bones as well. With our laceration injury, that's just kind of like a cut, and you can just cut through, the first couple layers. It can be, cut as deep into the subcutaneous tissue, into the muscle tissue. And then with our puncture injuries, those are things like a gunshot wound, a stab wound, things like that. So I hope that this video is helpful for you. Looking at the different mechanisms of disease, and then looking at our introduction into pathophysiology. So, all right, thanks so much.